97.9, 105.5 KISS FM. It is Listen, It's Liz, and we are learning lupus with our friends at Masonic Medical Research Institute all month long. Today is our first guest, and I'm so excited to welcome in Dr. Chase Kessinger. Good morning. How are we?
We're doing very well. Thank you.
I'm happy to have you in studio. And for those who do not know, we're getting ready for the second annual Lupus Walk, Saturday, May 17th at Masonic Care Community Campus. So let's talk a little bit about MMRI, what you do there, and what it means to be a part of this team.
Right. So I'm a principal investigator at MMRI. It means basically I run a lab of a couple people studying certain diseases.
Yeah.
In this case, my focus is in venous thrombosis or blood clots. And we have a couple people in the lab working on different aspects of that. But for this talk today, we're going to talk about how we do some lupus research.
Yeah.
We do have a kind of a, I guess you'd call it a scheme or a couple things that people are looking for. And I think over the years, we've become very good at physicians, that is, as diagnosing this early on or earlier than they used to. So those things are important. And then what we're trying to study is basically how all of that biology kind of initiates some of these other things that happen in these lupus patients, those being blood clots.
Some of these symptoms that those who have lupus go through are like normal everyday things, but blood clots and working with the heart and cardiac and all of that kind of stuff, it mixes so well into each other, that makes it that your work, when you go through and you're trying to research and look into what exactly are you looking into?
Sure. So we are looking at, well, we could start with the lupus patient themselves. So in adolescence, in the young early 20s, basically some of these people go through an episode, is what it's called, where they have blood clots, some of them very dangerous, in fact, leading to mortality. But what we're looking at is in the context of how these lupus patients have overreactive white blood cells, so the immune cells of the body, and how that interplay between the immune cells and the vasculature, so your blood vessels, kind of interact to cause or initiate these blood clots. So they're very dangerous in this population. Basically, that you can throw blood clots in multiple organs at one time, leading to catastrophic things. So lupus, in the lupus disease model that we study, we're trying to unravel or understand, elucidate those kind of factors and how those cells, those overactive immune cells, contribute to making those blood clots.
So how long have you been working on this project?
So with LADA's funding.
Oh, wait, before you get too far, what is LADA?
LADA stands for Lupus and Allied Diseases Association, Inc. And
what do they do for you?
Well, they sponsor research at MMRI. Specifically for me, we've held a grant from them for 2 years now, which allowed us to basically put our foot into the realm of lupus work. Now, I've been working on blood clots or DVT for over, 15 years now.
Yeah.
And again, as an imager, we kind of study it through the lenses of microscopes and other, translational machinery like ultrasound and CT. So what we're able to do is take our models, look at how these cells are interacting in real time to understand kind of what's going on when these things are forming.
How is it when because this is like patient driven, like do you get to meet those who you are like taking these scans from?
Right. So that's unique about the Utica and MMRI area. LADA is actually very local, almost, reach out and touch them kind of.
Yeah.
So I've been blessed with their support and their ability to bring in their patient advocates.
Yeah.
So we've met them, I've spoken with them. And it's actually interesting, you read papers as a researcher, you never really meet the people.
Yeah.
And in meeting the people, you understand that this is actually, it's not like 1 in 10 or something like that. This affects, the blood clots affects more people than you think. So as a researcher, that makes it hit home a little bit harder.
Yeah.
And makes you kind of get going a little bit faster. So.
Oh, for sure. And the second annual Lupus Walk that's going down Saturday, May 17th, what's great is the funds raised are going to go right back into the research that is happening at MMRI. And so it's all staying local. And do you have like a favorite part of why you love your job?
Ooh.
I know, that big question.
I tell this to all of my kids, the 2 of them, that, it's not really work. Once you find that thing that you love doing, you kind of just get after it.
Yeah.
Research is one of those things that is very beneficial in that fact that each thing day to day, as a principal investigator, you get to kind of think about what you want to work on. You're always using your mind and kind of trying new things out. So it's a little bit different than most other professions in that aspect, which makes it a lot of fun for me.
And you can come down and join us at Masonic Care Community. And if you want to learn more, will you be there, Dr. Chase?
Yes, they usually position me at the registration table. So if you like an autograph or limited edition t-shirt, bring your Sharpies. I can draw butterflies as well.
Oh, perfect. Yeah. Oh my gosh. I know exactly what I want to get on my t-shirt now. T-shirts are actually still available, and they will be for order through tomorrow, and limited quantities will be available at the day of the walk as well. And if you want them signed special, just ask nicely.
Yeah, perfect.
We are learning lupus. We're going to have all kinds of guests all month long. Make sure you're following along. More details at cnykiss.com, and join us for the second annual Lupus Walk on Saturday, May 17th, Masonic Care Community with MMRI right here on KISS FM.